Hi, I'm Neil Stoner. I'm a physician assistant here at OrthoKnox, and today we're going to be talking about commonly asked questions after arthroscopic shoulder surgery. The first question that we commonly get is about driving after surgery. And there are three requirements that we typically want to happen in order for you to drive. The first is that it's been 2 weeks from surgery. The second is that you have to be off of all narcotic pain medicine. And finally, you have to be comfortable driving in the sling. Many patients are not comfortable driving in the sling, especially if it's your dominant arm. And if that's the case, then it may have to be once you come out of the sling in order to drive. The next question we commonly get is about how long you'll be in the sling. And that depends greatly on the type of surgery that you have. Patients who have smaller cleanup type surgery typically is 2 weeks. Larger surgeries like rotator cuff repair surgeries, typically it's between 6 and 12 weeks depending on the size of the tear that you have. And we'll go into that in more detail at your postoperative appointment. The next question that we commonly get is about going back to work. Typically, we'd want you to wait at least 2 weeks after your surgery to go back to work. In some cases, especially if you have a manual labor type job, we'd want you to be out of the sling prior to going back to work. So in those cases, it may be more like 6 to 10 weeks before you're able to go back to work. Patients who do work in a office type setting, if it is your dominant arm, you may have some limitations when you go back to work in the sling. The next question we commonly get is about showering. You'll see our therapists soon after your shoulder surgery who will take down your initial dressing. At that point, typically we let you go ahead and shower. So typically it's 1 to 2 days after your surgery until you're able to shower. The next question we commonly get is about starting physical therapy. And with that, typically you start within a couple of days after surgery. And that will progress for about 3 to 4 months, depending on the type of surgery that you have. The next question we commonly get is about when to call our office. For that, typically it's with fevers greater than 101 degrees, excessive drainage, or a general ill feeling. If you have any of those symptoms, don't hesitate to contact our office and one of our skilled providers will be happy to address it. The next question we get is about pain management after surgery. Just prior to your surgery, you'll get a nerve block which will numb the shoulder and the entire upper extremity. And that lasts for between 1 to 3 days. Once that wears off, then you'll have narcotic pain medicine to take. And most patients just need that for a couple of weeks. And even at that point, pain tends to be not terrible after this type of surgery. And then you're able to transition to taking medicines such as ibuprofen and Tylenol. The next question we commonly get is how long will the surgery take? Typically with our arthroscopic shoulder surgeries, they take between 1 and 1.5 hours to complete. Finally, many patients ask how to get the best result from their surgery. And for that, I typically talk about 2 things. First is staying in your sling as much as possible. Many patients who do end up with an injury after their shoulder surgery, it's typically when they're out of their sling. The sling is there to help protect the shoulder and help protect you after your surgery, and it's very important for that. Also listen to your physical therapists. They're there to help you get the best result from your surgery, and they're paramount to your success, and they will help lead you in the right direction after your shoulder surgery.